In a patient who needs a lumbar puncture, there will be interpretation of the findings of the cerebrospinal fluid. If red blood cells are found on the tap, it could be a traumatic tap if no xanthochromia is noted. However, if there's xanthochromia or a yellow discoloration of the supernatant of a spun CSF sample, we can make a diagnosis or a conclusion that there may be subarachnoid hemorrhage or hemorrhagic encephalitis, as the yellow discoloration is the presence of lysed and broken down red blood cells. When white blood cells are found in CSF, differentiation of the cell lineage is important to determine what type of infection might be occurring in the CSF. If there is a high concentration of neutrophils, or PMNs, it is likely that it is a bacterial or potentially an early viral infection. If lymphocytes are the predominant white blood cell in the CSF, it is likely an infection that is going to be caused by viral, fungal, or mycobacterial. Lymphocytes in the CSF may also indicate a demyelinating process, such as MS. It may also point to a central nervous system lymphoma. Elevated protein is indicative of an infection, fungal or mycobacterial, demyelination, tumor, sarcoidosis, or increased age. Low glucose is going to correlate with a bacterial infection or a mycobacterial infection. Oligoclonal bands in the CSF are an indicator of demyelinating processes such as MS, CNS infections such as Lyme's disease, non-infectious inflammatory processes such as lupus. Positive Epstein-Barr virus PCR is highly suggestive of CNS lymphoma in patients with AIDS or other immunosuppressed states. In a patient with bacterial meningitis, we would expect the dominant cell type to be PMNs, the protein level to be high, glucose level to be low. Culture and gram stain may also be positive in a bacterial meningitis. In a viral meningitis or encephalitis, we would expect the predominant cell to be lymphocytes, the protein level to be high, the glucose to be normal. Viral PCR may be positive in a viral meningitis. Tuberculous meningitis, we would expect the predominant cell to be lymphocytes, protein levels to be high, glucose to be very low, and positive for acid-fast bacilli in the CSF. In Guillain-Barré syndrome, we would expect the cells to be present would be none. Protein to be high. Degree depends on interval from symptom onset. The glucose to be normal. This is known as an albuminocytologic dissociation. In multiple sclerosis, the cells of the CSF would be scant lymphocytes. Protein would be slightly high. The glucose would be normal, and a distinguishing factor would be oligoclonal bands. In a subarachnoid hemorrhage, the predominant cells would likely be lymphocytes, as well as many red blood cells. The protein may be high due to this increase in cells. Glucose will be normal, and the key finding will be xanthochromia. Some key points to take away. A CT scan should be performed prior to lumbar puncture, except in situations where bacterial meningitis is suspected. Lumbar puncture is performed at or below the L2-L3 interspace. Xanthochromia indicates recent intrathecal hemorrhage.